Okay, we are going to discuss about Nido Cardioplegia Solution. Among the various cardioplegia solutions, Nido Cardioplegia Solution has emerged as a widely preferred option due to its efficiency and prolonged myocardial protection. Nido Cardioplegia Solution is a blood-to-crystalloid solution designed to induce longer duration of cardiac arrest and protect the myocardium during cardiopulmonary bypass. It was originally developed for a pediatric cardiac surgery, but it is now increasingly used in adult cardiac procedures also because of its single-dose strategy and longer myocardial arrest time, that is approximately 90 to 60 minutes, which reduces the need for repeated dosing and interruption during surgery. Now we will see the compositions of Nido Cardioplegia solution. The effectiveness of this cardioplegia lies in its carefully balanced composition, where each component plays a specific protective role. The base of this cardioplegia solution is usually plasmalite A over similar crystalloid, which helps to maintain electrolyte balance and physiological osmolarity. In this crystalloid solution, some additives are added, which are: first is potassium chloride. It is a primary agent responsible for inducing cardiac arrest. It increases extracellular potassium levels, leading to partial depolarization of myocardial cells and stopping electrical activities. Second component is lidocaine. Is a key component that differentiates Nido cardioplegia from traditional cardioplegia. It acts as a sodium channel blocker, stabilizes myocardial cell membrane, reduces myocardial cell excitability and prolongs the cardiac arrest. Third component is magnesium sulfate, which inhibits calcium entry into cell, thereby preventing calcium overload and reducing myocardial injury during ischemic period when cardioplegia is administered. Fourth component is mannitol, which serves as a osmotic diuretic and free radical scavenger and helps to reduce cellular damage and edema. Fifth component is sodium bicarbonate. It acts as a buffer which prevents the acidosis and lowers the pH in cardiac cell during ischemia. Now we will see the exact mechanism of action of Nido Cardioplegia solution. The mechanism involves in both electrical arrest and metabolic protection of myocardium. The elevated potassium concentration in myocardium reduces potassium gradient across cell membrane. This shifts resting membrane potential from -90 mV to around -40 mV, which is partial depolarization of the cells. At -40 mV, most of the sodium channels remains inactivated, so no further depolarization and contraction. That's how it arrests the heart. Preparation of Nido Cardioplegia solution. In 500 ml of plasmalite A, we add 13 ml equivalents of potassium chloride, 1 gram of magnesium sulfate, 13 ml equivalents of sodium bicarbonate, 8 ml of 20% mannitol, and 3.3 ml of 2% lidocaine. And dose of this cardioplegia solution is 20 ml per kg for adults and 30 ml per kg for pediatrics. And Nido Cardioplegia delivered at 1:4 ratio. It means 1 part of blood mixed with 4 part of cardioplegia solution.